Vice Director on Academic and Student Affairs, and also Honorable Professor Eddie from Erasmus, and all the professors and representatives from Fritz University Amsterdam, and also from Erasmus, from NUFIC, also from the Association Institute Global Health Development, Netherlands, and our colleague from BPJS. We also hear Honorable from InHealth, and also PAMJAKI. So PAMJAKI is the Association of Health Insurance Expert and Financing in Indonesia. And of course, Honorable Vice Dean Ibu Adi Utarini, and our Professor Pak Laksono, and all the lecturers from many universities, University from Diponegoro, Ibu Grace, and also University from Sumatera Utara, Ibu Juanita, and also our colleague from other universities, lecturers, professors, and also ladies and gentlemen. First of all, I would like to thank for all of you, especially our colleague from Netherlands, who already working together to develop and also to help how the implementation of national health insurance in Indonesia will be successful. Of course, since implementation of universal coverage program in Indonesia, January 2014, we are of course very happy, and the government, also the people are really committed to implement this program. But of course we are facing many challenges. So the challenges, first, this include to the availability of human resources in health, especially in health finance and health insurance. Second, of course, the health infrastructures. We are also not quite ready yet. In fact, during over the last 6 months, every 2 days, there is new hospitals is built in Indonesia, but of course followed by health technologies, medical equipments, but we are not ready yet how the technology assessment units to assess whether actually the new technology is cost effective or not. And there are many problems, issues need to be studied. And therefore, I think this project, which is funded by NUFIC, with our colleague from Erasmus, from Institute of Global Health Development, Netherlands, and also from VU, and from Gajah Mada University, Faculty of Medicine, especially also health financing and health insurance center. We are working together, but we are hoping that this project, which is, with the funded around 1,500,000, or around in Indonesian rupiah is more than 20 billion rupiah, atau 20 miliar lebih. This is for 4 years project. So we hope that this project really beneficial for both of us, for developing the new knowledge and existing knowledge, and also beneficial for our people, especially in Indonesia and also Netherlands. And as we know that we are having very close relationship, not because only for the history, but also for many things. And especially in this Faculty of Medicine, we are, I think, many times having project which is in relation with NUFIC. And of course, it is not easy, and we have to be responsible of our project and to be successful. And as I mentioned yesterday, there are many critical factors which influence the successful of these projects. And therefore, we also would like to have the impact of this research, not only on human resources development, especially in health finance and health insurance, but also, in research to solve our problems. But of course, there are many foreign colleagues which are eager to know what is the development of implementation of universal coverage program in Indonesia, because we are having limited international publications, especially to describe what are really the problem and how far the implementation of universal program in Indonesia. Of course, if you see compared to Thailand, for example, Thailand, which is only having around 65 million people, having 3 types of schemes. In Indonesia, we have 250 million people with only 1 scheme in our dreaming, and only managed by 1 health insurance carrier. So compared to Germany, first time it was developed by Otto von Bismarck in 1883, up to now in Germany, more than 150 health insurance carrier or BPJS. So Indonesia is really charming. So therefore, many experts also wanted to know whether we are successful or not. If compared to US, for example, I many times make a joke. Actually, Indonesia and US sharing many things. One of the share, actually, we are having, a president in which Obama, actually when he was child, we sent him to the school in Jakarta. So after to be the smart person, then we sent him to be the president of US. And one mission, we put it for him is to develop healthcare reform, Obama healthcare reform, which is, to cover the universal health coverage. And there are many problems in US. So therefore, if Obama still having that problem, we would like to call him back in Indonesia to see how we implement. I'm not sure whether then he will be more confused or maybe will many things to learn. Therefore, we hope that this project will really beneficial and also giving the answers of challenges and problems we are facing. And there are many opportunities of the project. At least we are developing the curriculum for preparing human resources in health finance and health insurance. Then second, this relate to the research topics. So after this opening ceremony, we will discuss about the topics of research. Then third, that is related to the outreach training program is actually. So how to have a tailor-made of trainings for those who are actually needed. For example, Indonesia now pay attention on primary healthcare doctors. So some of the doctors are not yet trained how the capitation, how the payment, etc. So by using the outreach training program, we hope that they will be beneficial. And then fourth is the program on investment and also on strengthening organization. So these 5 sector or component of this project are emphasized and have special coordinator or sub-coordinator who are responsible for this. And for those for you, both from internal Faculty of Medicine or from Gadjah Mada, and also from outside Gadjah Mada, you can participate. Of course, depend on what type of the participation. So we are of this project having scholarship also for master degree and also for PhD degree. I think that is all, and again, thank you very much, especially our colleague, Prof. Eddie, and all our colleagues from Netherlands, and for the special for our Vice Rector, Prof. Iwan Dwi Prasto. And that is all, and thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
To talk to you and to introduce both our team and the project that we've put together with Pak Gufron. What I'll do is I'll briefly introduce who we are, what the consortium consists of, who's involved from the Netherlands, and then I'll say a few words about the project. Who are we? Well, we are actually a consortium of mainly two universities, Erasmus University in Rotterdam and the VU University in Amsterdam, and a number of institutes associated with them. And they're listed here. On the left-hand side, we have the Rotterdam institutes, where I work, and Dr. van der Poel, who's here. Institute of Social Studies in The Hague, and the Rotterdam Global Health Initiative. From the VU University in Amsterdam, and we have two representatives here as well, and I'll introduce them later. The Center for International Cooperation is part of it, the Department of Development Economics and Health Economics, and the Amsterdam Institute for Global Health and Development. So the two universities together have joined forces to put in a proposal for the tender, and we've won the tender, and now we're preparing the project. So representatives present here today are these people here with their pictures, so you can't get the names wrong. I myself am a professor of health economics at Erasmus University in Rotterdam, both at economics and at the medical faculty, so it's a joint professorship. And I've had some experience with national health insurance in Asia, including Indonesia, in two large EU-funded projects. One was called EquiTap, Equity in the Finance and Delivery of Healthcare in the Asian Pacific region, which included actually Professor Laksono from Gajah Mada, where we did a first comparison in more than 13 countries in Southeast Asia on the extent to which different social groups have access to healthcare and pay for healthcare. That finished about 5 to 6 years ago. And then we started another project, which was called Health Equity and Financial Protection in Asia, in 6 countries only, where we looked particularly at the impact of reforms. In Indonesia, that meant at that time FK-KMK, but in China, Philippines, Thailand, Cambodia, and Vietnam, these were other reforms, and I'll say a bit more about that later this morning. So we have some experience, and now one of the exciting new reforms that is going to happen is, and that's already started, is a national health insurance implementation in Indonesia. And not only us, but as Professor Gufron said, the whole world is interested to see how Indonesia is going to move towards fuller and hopefully eventually universal coverage of its large population. Dr. Ellen van der Poel is also working in my department. Ellen is here. Professor Menno Pradhan is at the VU University in Amsterdam. He also has extensive experience working in Indonesia. He lived for 7 years in Jakarta when he was working for the World Bank, not only working on health, but also on educational programs. So he's more experienced than any of us working in Indonesia, and we look forward to this collaboration. Esther den Hartog, she's the project manager, and she works at the Center for International Cooperation of the VU University, and she coordinates the consortium. And also she has extensive experience working in Indonesia. Well, what does this bring together? Well, we think we've brought together academic excellence in relation to health insurance, as in the sense that I explained. Of course, we also work a lot on health insurance in the Netherlands and in other countries, but I think most relevant to this project is the experience we have with health insurance in Asian countries. And with a focus on the developing countries, as there is in the development economics departments. We also have experience with capacity building in various parts of the world, and that's an important, if not the most important part of this project, because it's partly capacity building here and partly research. Well, I'll talk more about the project later, but we have already spent half a day or all day yesterday discussing the development of the curriculum of health insurance and finance here in Gajah Mada, and about strengthening the organization to achieve those objectives. And as I already indicated, we have some familiarity with Indonesian health insurance issues as we were involved in evaluations of FK-KMK and other programs in the past. Well, I don't think I need to underscore the challenges for KPMAC. With such a large reform planned, I think there's going to be a tremendous need for qualified people to implement that. So that burden, I'm afraid, is on you. But if at all we can help you in getting prepared to do that, then we would be very pleased if we can achieve that over the next 4 years. We'll also talk about research. That will be the subject of discussion today, and the next few days we'll be talking about the other sub-projects. So let me finish by sketching the structure of the collaboration. So what we will do first is review the already existing Master in Health Insurance and Finance here at Gajah Mada and see to what extent it can be improved, taking examples also from our own masters, the similar master that we run in Amsterdam and in Rotterdam. Secondly, we'll also try and expand and improve on the research and the implementation of research results on health insurance in Indonesia. As Dr. Gufron just said, there is still not enough known internationally about what's happening, and joint international publications would help in promoting that and would benefit both health insurance here and also the wider dissemination in the region and in the world. And the way we do that is by combining our Dutch consortium with UGM, funded by NAFIC, which is the Dutch institution that funds this capacity building effort. We'll not only do curriculum review and research, we'll also extend outreach to stakeholders through conferences, workshops, e-learning, etc. So, to close off, what is the project all about? And that's really in one slide. Well, while we have identified 5 sub-projects, which are here: curriculum review, strengthening research capacity, social outreach, organizational strengthening, and investment. Well, the main focus will be on curriculum review and research capacity, but also these other aspects deserve and will get the attention they need over the next few days and over the next 4 years as we go along in the collaboration. So we are very excited to have this opportunity, to be given this opportunity to collaborate, and we hope that in 4 years from now or so we can report to you what we have achieved in these 4 years of collaboration. Many thanks.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, Professor Reddy, our distinguished lecturers, guests, speakers, colleagues from Free University, Erasmus consortium of this project, professors, participants, vice deans of research and postgraduate faculty of medicine. First of all, I would like to express our gratitude for being here with you. Thank you for visiting Indonesia to see directly how Indonesia is developing a new terms of health insurance. Professor Ali Gufron, former Vice Minister of Health, he was the one who at least created this new wave, and he will be responsible for the wave now. Thanks for having this meeting, collaborative meeting. As you may know, the Indonesian national health insurance, like a baby, was just born last year. This is the second year of the life. Even though this is the reborn of a new baby that was actually started by ASCAS on 1987. It was 92 or 97?
69.
69, and then PK. Yeah. Well, so many years we have learned how to manage, to organize the insurance, and I think the best lesson learned is that now we are entering era in which this country decided to have only one system, as mentioned by Professor Ali Gufron just now, by only one system, which is our scheme, one system of the national health insurance. Of course, everybody is watching whether the successful of the program will be easily seen in the near future, or whether some challenges in the future will make us reevaluate whether this program is proper to be implemented in this country. However, I'm very sure that this is the right way to go. Otherwise, Indonesia is the big country with almost 250 million people will suffer if they don't have a system for managing healthcare. Looking at the 1 year experience of national health insurance, of course, we will only see problems. Internally, every clinician will see this is a new problem for us. For the Ministry of Health, see this as the new big problem for us. And when we see at the university, this is the challenge for us to develop a new knowledge on how health insurance is implemented in this big country. It will be seen by all of the countries, whether the sexes.
No problem for the managers BPJS.
No problem for the manager, even though they suffer a lot. This is a good opportunity, of course, to collaborate with other partners all over the world. And special thanks for the NFIC for giving this opportunity, collaborating with the consortium that has been mentioned by Prof. Eddie. This must be a startup for providing a new knowledge whether this national health insurance systems, which is only one, can cover all the problems which may be faced in the future by this country, one of the third biggest country in the world. Of course, when we are talking about the resources, lack of resources can be seen everywhere. Number of health services available sometimes make us cannot sleep well, because the access of the people in the remote area are still challenging. So, I mean, we are facing two things. First, whether this can be implemented, this national health insurance system can be implemented in this country. The second, whether this national health insurance systems will improve the quality of healthcare in this country. These two key points must be learned and must be also studied. And by having this opportunity to collaborate with Free University, Erasmus, and the consortiums, I do hope that these collaborations will create a new knowledge on how a new system of health insurance can be implemented in such a big country with some limitations, resources, health system, health services, provider, etc. and so forth. The BPJS team, I'm very sure they have a lot of experience, more than 28 years, and I do hope that they could face this new challenge properly. On behalf of the Rector of Universitas Gadjah Mada, I would like to thanks for the distinguished speakers, our colleagues who are having similar vision to provide us Indonesian new era with the new knowledge of health insurance, national health insurance. I do hope this 5 days meeting will be fruitful, and the follow up of the meeting will be also part of the most essential development of the national health insurance in this country. And the world is waiting whether the result of these collaborations could really be seen by everybody in the world that it works under the system of the national health insurance in Indonesia. The Universitas Gadjah Mada is supporting very much this. At the beginning of the system that was implemented last year, the chairman of the BPJS was also approached the university to work with us together to develop new knowledge or to collect the new knowledge and vision on the future of health insurance in this country. It is our great pleasure to have you here, and by having this meeting, allow me to officially open this collaborative meeting between Universitas Gadjah Mada, especially Center for Health Insurance and Finance, which is chaired by Professor Ali Gufron Mukti, and the collaborators. We officially open this collaboration. Thank you very much.